Stroke symptoms, causes, and prevention. Stroke, symptoms, causes, and prevention. A stroke is a serious life-threatening medical condition that happens when the blood supply to part of the brain is cut off. Strokes are a medical emergency and urgent treatment is essential. The sooner a person receives treatment for a stroke, the less damage is likely to happen. If you suspect that you or someone else is having a stroke, call for medical emergency and ask for an ambulance. Symptoms. Even if the symptoms disappear, it's still important to go to hospital for an assessment. After an initial assessment, you will be referred to a specialist for further tests to help determine the cause of the stroke. You should be referred to see a specialist within 24 hours of the start of your symptoms. Treatment can also begin if necessary. Symptoms of a stroke that disappear quickly and in less than 24 hours may mean you had a transient ischemic attack, TIA. Symptoms should also be treated as a medical emergency to reduce the chances of having another stroke. Transient ischemic attack, TIA. A transient ischemic attack, TIA or mini-stroke is caused by a temporary disruption in the blood supply to part of the brain. The disruption in blood supply results in a lack of oxygen to the brain. This can cause sudden symptoms similar to a stroke, such as speech and visual disturbance, and numbness or weakness in the face, arms and legs. But a TIA does not last as long as a stroke. The effects last a few minutes to a few hours and fully resolve within 24 hours. Recognizing the signs of a stroke. The signs and symptoms of a stroke vary from person to person, but usually begin suddenly. As different parts of your brain control different parts of your body, your symptoms will depend on the part of your brain affected and the extent of the damage. The main stroke symptoms can be remembered with the word fast. Face. The face may have dropped on one side, the person may not be able to smile, or their mouth or eye may have drooped. Arms. The person may not be able to lift both arms and keep them there because of weakness or numbness in one arm. Speech. Their speech may be slurred or garbled, or the person may not be able to talk at all despite appearing to be awake. They may also have problems understanding what you're saying to them. Time. It's time to dial 999 immediately if you notice any of these signs or symptoms. It's important for everyone to be aware of these signs and symptoms, particularly if you live with or care for a person who is in a high-risk group, such as someone who is elderly or has diabetes or high blood pressure. Other possible symptoms in the FAST test identify most strokes, but occasionally a stroke can cause different symptoms. Other signs and symptoms may include complete paralysis of one side of the body, sudden loss or blurring of vision, dizziness, confusion, difficulty understanding what others are saying, problems with balance and coordination, difficulty swallowing, dysphagia, a sudden and very severe headache resulting in a blinding pain unlike anything experienced before, loss of consciousness. But there may be other causes of these symptoms. Causes. There are two main types of stroke, ischemic strokes and hemorrhagic strokes. They affect the brain in different ways and can have different causes. Ischemic strokes. Ischemic strokes are the most common type of stroke. They happen when a blood clot blocks the flow of blood and oxygen to the brain. These blood clots typically form in areas where the arteries have been narrowed or blocked over time by fatty deposits known as plaques. This process is known as atherosclerosis. Your arteries may naturally become narrower as you age, but there are some things that dangerously speed up this process. These include smoking, high blood pressure, hypertension, obesity, high cholesterol levels, diabetes, excessive alcohol intake. Another possible cause of ischemic stroke is a type of irregular heartbeat called atrial fibrillation. This can cause blood clots in the heart that break apart and end up in the blood vessels that supply the brain. Hemorrhagic strokes. Hemorrhagic strokes, also known as cerebral hemorrhages or intracranial hemorrhages, are less common than ischemic strokes. They happen when a blood vessel inside the skull bursts and bleeds into and around the brain. The main cause of hemorrhagic stroke is high blood pressure, which can weaken the arteries in the brain and make them more likely to split or rupture. Things that increase the risk of high blood pressure include being overweight, drinking excessive amounts of alcohol, smoking, a lack of exercise, stress, Hemorrhagic strokes can also be caused by the rupture of a balloon-like expansion of a blood vessel, brain aneurysm, or abnormally formed blood vessels in the brain. Reducing the risk of a stroke. It's not possible to completely prevent strokes because some things that increase your risk of the condition cannot be changed. These include age. You're more likely to have a stroke if you're over 55, although about 1 in 4 strokes happen to younger people. Family history. If a close relative, parent, grandparent, brother or sister, has had a stroke, your risk is likely to be higher. Ethnicity. If you're South Asian, African or Caribbean, your risk of stroke is higher, partly because rates of diabetes and high blood pressure are higher in these groups. Your medical history. If you have previously had a stroke, transient ischemic attack, TIA, or heart attack, your risk of stroke is higher. But it's possible to significantly reduce your risk of having a stroke by making lifestyle changes to avoid problems such as atherosclerosis and high blood pressure. You should also seek medical advice if you think you may have an irregular heartbeat. This can be a sign of atrial fibrillation, which increases the risk of a stroke. Prevention. The best way to help prevent a stroke is to eat a healthy diet, exercise regularly, and avoid smoking and drinking too much alcohol. These lifestyle changes can reduce your risk of problems like arteries becoming clogged with fatty substances, atherosclerosis, high blood pressure, high cholesterol levels. If you have already had a stroke, making these changes can help reduce your risk of having another stroke in the future. Diet. An unhealthy diet can increase your chances of having a stroke because it may lead to an increase in your blood pressure and cholesterol levels. A low-fat, high-fiber diet is usually recommended, including plenty of fresh fruit and vegetables, 5 a day, and whole grains. Ensuring a balance in your diet is important. Do not eat too much of any single food, particularly foods high in salt and processed foods. You should limit the amount of salt you eat to no more than 6 grams, 0.2 ounces, a day, as too much salt will increase your blood pressure. 6 grams of salt is about 1 teaspoonful. Exercise. Combining a healthy diet with regular exercise is the best way to maintain a healthy weight. Regular exercise can also help lower your cholesterol and keep your blood pressure healthy. For most people, at least 150 minutes, 2 hours and 30 minutes, of moderate intensity aerobic activity, such as cycling or fast walking, every week is recommended. If you're recovering from a stroke, you should discuss possible exercise plans with the members of your rehabilitation team. Regular exercise may not be possible in the first weeks or months after a stroke, but you should be able to begin exercising once your rehabilitation has progressed. Stop smoking. Smoking significantly increases your risk of having a stroke. This is because it narrows your arteries and makes your blood more likely to clot. You can reduce your risk of having a stroke by stopping smoking. Not smoking will also improve your general health and reduce your risk of developing other serious conditions, such as lung cancer and heart disease. Cut down on alcohol. Excessive alcohol consumption can lead to high blood pressure and trigger an irregular heartbeat, atrial fibrillation, both of which can increase your risk of having a stroke. Because alcoholic drinks are high in calories, they also cause weight gain. Heavy drinking multiplies the risk of stroke by more than 3 times. If you choose to drink alcohol and have fully recovered, you should aim not to exceed the recommended limits. Men and women are advised not to regularly drink more than 14 units a week. Spread your drinking over 3 days or more if you drink as much as 14 units a week. If you have not fully recovered from your stroke, you may find you have become particularly sensitive to alcohol, and even the recommended safe limits may be too much for you. Managing underlying conditions. If you have been diagnosed with a condition known to increase your risk of stroke, ensuring the condition is well controlled is also important for helping prevent strokes. The lifestyle changes mentioned earlier can help control these conditions to a large degree, but you may also need to take regular medication. Please like, subscribe, and share.